Hello, this is Jane Taylor. I'm an improvement advisor with the Surviving Sepsis campaign, brought to you by the Society of Critical Care Medicine. And today I want to talk about communication in relationship to your spread plan. So I'd like to thank the Institute for Healthcare Improvement and the country of Ghana for their work in the 5 Alives campaign to reduce infant mortality 0 to 5, because I'm going to be presenting today lessons learned from that campaign. So the first thing about having a great communication plan is planning. So you actually have to create a communication plan, and in that is the strategy, that a communication strategy organized for internal and external groups. So you have internal customers who want information, and that's all the people that work for you, including people that pay for care, and your external groups, which are any external constituents that you have or community partners. And then you want to make sure that you're including harvesting the changes that are working in the spread plan, that is, the better ideas, and making sure that you're sharing what you're learning in that communication plan. So how is the work being done? What are the processes that make these changes work, make them easy to adapt? And that should be included in part of your communication plan, as well as publication ideas. What journals are we going to publish in? What professional newsletters do we want to send messages to and publish in? What vehicles do we want to use to communicate? There's a lot more than just scholarly journals. And what is the periodicity? How often do we want to send out communication about our project? And again, your communication plan fits very nicely with the sense of urgency around the project, because you need to have some good results to communicate. So getting good results makes it easy to communicate what you're doing. And don't forget social media. So there are a lot of ways that you might want to reach out to your constituents through social media. And you want to include, when you have anything that you're communicating, what progress have we made so far and what are our upcoming plans. And then if you have a really large-scale project, so for example, if you are leading a healthcare system or a group of hospitals, you might want to have a designated person who interfaces with groups to respond to requests for information, respond to requests for documents, respond for requests for speakers, and who is designated to work with the media and help with any technical writing. So one of the nice things that you can do in a spread project is that if with your faculty, they can become authors of journal articles and publications with technical assistance from this person. And so that's also a way to give them some professional esteem around the project. So you want to select also the professional meetings where you want to tell the story. So for example, we will be telling our story at the annual meeting for the Society of Critical Care Medicine. We're also telling our story with the Organization for Hospitalists. So we've got to think about now, where are the professional nursing meetings where we want to tell our story, the respiratory therapy meetings where we might want to tell our story. So thinking about those professional meetings is another strong, powerful vehicle for communicating what's happened so far and where we're going. So think serially, not just one meeting, but over the next 4 years, what do we want to present at these professional meetings? And then I think it's a great idea if you publish an annual report on the spread topic. Lessons learned, what's happening, what are the most powerful changes, how are we doing, and feature really successful units that have adopted some of the spread changes. And then publish these reports for the hospital. It might be a unit publication, or it might actually be a regional or a systems publication. So another idea, and this is a screenshot from the 5 Alive webpage, is to create and maintain a website that is devoted to the project. And this website is actually pretty interesting. They've got a home page, and they explain who we are, what we do, who are our partners. All their publications are there, news and upcoming events, bios and photos of the team and how to contact those involved in the campaign. And then they have a lot of photographs that are reinforcing and actually making the project come alive. So when I go to this website, I kind of feel like I went to Ghana and I could observe what happened. And not only that, but it gives me ideas about what I want to do with my spread project. So an important part of any communication campaign is identifying who your audience is. So who are your key stakeholders? Who are the planning groups that you're working with? Your funders, and your various publics. And then the actions that you have to take are assigning key local improvers and coaches and engage them in the reporting process so that it's easy for you to put together communication materials. And then carefully select your venues, that is your professional organizations, summits, meetings, etc., that can communicate the progress of the project. And that's not just for the hospital, but also do that with your stakeholders because they have places that they go where they can tell the story. And the more outreach you have, the more support that you can build and enlist for the project. And then consider other groups to connect with who are working in related areas. So maybe you want to work with a supply chain group that is working on making sure that important pharmaceuticals are available on units. And so for us, that would be making sure we had antibiotics and fluids right at hand. So how could we begin to connect with others working in related areas that may not be part of our internal system? And then balancing doing the work with sharing the work. So there's always, we want to share what we're doing, but we have to have something to share. So both are important. So you might consider hosting writing events. So we may, for example, gather our faculty and some of our key stakeholders together and have a day or two where we lock ourselves or sequester ourselves in a room, divide up the duties of writing articles, and we actually have a writing event with a technical assistant there to help us with that. So you want to include your partners in your communication plan. Tell the story and generate the narrative so that the story that's being told is related to what you're trying to create. So it's not so much that you're in control of the narrative, but that you shape the narrative around the results that you're getting and that the narrative is informed by the changes that you're making. And then lean in, and by that I mean get on the stage. Any chance you can get to stand up in front of people and communicate the value and the importance of what we're doing matters. So wherever we can, let's get on the stage and tell the story. And then remember that local cultures, climates, and languages, even the language communities we belong to, are all a little bit different. So it's great if you have a stakeholder in those areas that understands the changes, can translate them to a particular audience in a way that will be receptive for them. And then don't forget about free media, because free media is our friend. We can tap into that to tell our story on a broader scale. So in summary, this important work needs to be communicated, and our constituents deserve to hear the good work that we're doing and to understand what we're doing to protect them from sepsis and respond should they get it. So develop a plan for internal and external communication. Develop a communication plan along with your partners so that it's not a solo activity. Disseminate information regularly to your stakeholders and make the story a priority. Get on the stage, get your partners on the stage as often as you can, take advantage of media, and make sure that you're targeting the communication based on the audience who is receiving it. Thank you. Good luck with your spread communication.